Afternoon and welcome. Today is January 14, 2022. This is a continuation of the City Council meeting of January 10, 2022, and we are here to discuss a special matter, specifically the implementation of a mask mandate in the city of Minnetonka. So I will call this meeting to order, and I will turn it over to Acting City Manager Mike Funk. Mr. Funk.
Thank you, Mayor. Good afternoon, Council. As the Mayor indicated, I state this for our listening and viewing audience that my name is Mike Funk. I'm Acting City Manager. I'm here really to provide a few opening remarks before I turn it over to our City Attorney, Ms. Corrine Heine, to walk through the ordinance that's been presented to you in today's city meeting packet. First, I'll just, again, talk a little bit about our brief history and how we got here. The City of Minnetonka actually previously adopted a face mask mandate in July of 2020, which was by ordinance number 2020-14. Right at the onset of that ordinance adoption, Governor Walz also issued a statewide executive order that required masks prior to the effective date of the city's ordinance. And as a result, the city never at that time enforced our ordinance. The statewide mask mandate then ended in May of 2021. Since that time, and really with the uptick in the recent COVID cases related to the variant, there has been some recent resident inquiries. And this past Monday, on January 10th, the City Council added an item regarding the adoption of a citywide mask mandate. The Council then continued today's meeting, as mentioned by Mayor Wiersum, and so as a result of today's continuation, the Council directed city staff to prepare an ordinance and also to advise businesses and the public that an ordinance would be discussed. The City Attorney, as I mentioned, Ms. Corrine Heine, has prepared an emergency ordinance for the Council's consideration. The ordinance is similar to the Minneapolis face mask mandate, and that was also recently approved by the City of Minneapolis. There are some modifications to our ordinance, and that really we're trying to mirror the ordinance that the council that adopted the ordinance back in July of 2020. So it's very similar to that. There is some exceptions, however, noted. In terms of the public engagement process, and I know, Council, it's always important to you that we have public engagement, and a word that we often use is transparency and really looking to engage the public. For consideration of a mask mandate, we have communicated to the following businesses and to our residents in the following methods. First, we were able to notify over 700 of our license holders in the city, as well as all apartment managers. Stories highlighting meeting information have also been published to the city news, our website, and all sections of our city's website, as well as our social media channels, which is maintained by our communications division. Each story and social media post includes links to readers to share public comments and participate in the virtual meeting. Given the high level of interest in this topic, we also sent correspondence to 7,000 email subscribers about today's meeting and have added links in those correspondent pieces to add public comment. Finally, this meeting has been noticed to the local media organizations and has been reported both to the city's official newspaper, which is the Minnetonka Sun-Sailor, and the state's largest media organization, the Star Tribune. As of today, you'll know, Mayor and Council, that in your packet you received a number of email correspondence pieces. Those were sent to you in two different batches. The first batch that went to you yesterday contained 251 emails. And then again today, the second batch contained 324. So we're approaching nearly 600 emails from residents regarding this topic. We also then have an opportunity to hear from residents by phone. When we get to that portion of the agenda or that portion of today's meeting, we do have 26 callers that have signed up, and Mr. Dulac will help manage that along with the mayor as we get later into the meeting. The next thing I just want to touch base on is then the points of consideration. So Mayor and Council, you do have an ordinance in your packet. At the end of the staff report, we do have, I say we as staff have 3 questions for you, and perhaps you might have others. One is the expiration date, and that is currently blank in your ordinance. And really the question there for council is, how long do you want the ordinance to remain in effect? Under the charter, The maximum length is 61 days, but the council could set a shorter time period as necessary. So for example, the city of Hopkins, they chose February 14th, so really a 1 month out. So they took a 1 month approach towards the mask mandate. We can talk later as we get into the agenda, but just know that we will have to discuss, again, at what point do you want the ordinance to expire. I do have some other recommendations and thoughts for you, but we can reserve that for later in the conversation. Number two is related to schools. There was some discussion this past Monday, and with some mixed support for the ordinance to apply to schools. The language that you see today in the ordinance currently provides an exemption to other units of government that have facilities in the city, as well as all public and private schools. The exemption for schools does mirror the same ordinance and the same approach that was taken by the city of Hopkins this past Tuesday night. So as staff, we looked at trying to be consistent with our neighboring city that also shares a school district. The last discussion point is under other exemptions, and the question that staff would have for council is if there are any other additional exemptions that you'd like to consider. For example, churches is one that certainly comes to mind. So those are the three discussion points. Three options for you this afternoon, and those are you can approve the ordinance, and I say three options as I really, as staff, want to make sure that you have all options available to you this evening or this afternoon, and you have an opportunity to vet those out. So as I just mentioned, the first option is to approve the ordinance, and per city charter, an emergency ordinance does require 5 votes. The second option is if there are not 5 votes, then the ordinance would not be approved. So it's not really an option, but it's a result of not enough support or lack of support for the approval of the ordinance. And then last, staff took the opportunity, and I credit our city attorney, Ms. Heine, on including the resolution that both the city of Edina and Bloomington have approved this past week. I really look at that as middle ground, middle territory, if you will. It's a strongly worded resolution that strongly encourages masks to be worn in the community. So that is an option for you as well. Regardless of whether you chose to adopt the ordinance, or perhaps you don't adopt the ordinance, or even if you chose to adopt the resolution, the city staff would treat all those three options the same, and we would execute, certainly with the adoption of the ordinance or the resolution, the same, which means we would send out some templates, like a toolkit, to our business community, so we are providing resources available to them as they would look to implement this ordinance. The other thing I should back up is also the implementation of it. So you will need to decide when you'd like the ordinance to take effect if you choose to adopt the ordinance. We do have some thoughts on the staff level and a recommendation that, given today is Friday at mid-afternoon, that we would recommend that you consider adopting or making the ordinance effective on Monday, either later in the day Monday, or perhaps a clean break or a cleaner break might be Monday at midnight heading into Tuesday. Two last things worth mentioning is that we do have other staff here on the phone call. You do see them. These are available resources for you this afternoon. So council, if you have any questions regarding any updates of status on transmission rates, Jim Flanders, who is our assistant fire chief and also is our lead in emergency management, is available. Captain Rachel Meehan from our Minnetonka Police Department is available to talk about enforcement questions. We also have Miss Julie Wishnack, our Community Development Director, who can also discuss enforcement and also business licensing. Kelly O'Day, our Rec Director, is on the line, who can also speak to any questions you may have regarding any of our recreational facilities, which includes the Williston Center, ice rinks, warming houses, etc. And then last, I would just want to point out that of our 26 call-ins, one of those is Dr. Michael Oakes. He's an epidemiologist from the University of Minnesota. So you will hear from him also on the call. And then last, before I turn it over to City Attorney Corrine Heine, who will walk through the basic parameters of the ordinance, you'll notice that I am in the council chambers. And while the decision was made that it was prudent to move to virtual meetings, state law requires that the council room be made available to the public. So I am here this afternoon along with election specialist Kyle Solage, and council and mayor, you will not see the audience as the camera will be on staff, but I will report to you here that as of right now, we do not have anyone in the chambers. And as of right now, since no one's here, no one will be providing public comment, but if that changes, we'll certainly let you know. So with that, mayor and council, I'll turn it over to Ms. Heine for a brief presentation on the ordinance. Thank you.
Ms. Heine.
Mayor and council members, I'm going to walk through the ordinance for you, and I'll be sharing my screen. And oh. Okay, you should see the ordinance in front of you. I've started at section 3. The first part of the ordinance lays out the preamble and the findings that form the basis for adopting the ordinance. Section 3 is the meat of the ordinance, and it starts with the definition of face covering and space of public accommodation. These definitions are very similar to the definitions that were in the Minneapolis declaration, and also Golden Valley adopted language that I believe was identical to Minneapolis. This, however, mirrors the language from the Hopkins face mask ordinance. And the key difference is in the space of public accommodation. Hopkins, there's a typo in there. I'm going to have to fix that. Recreation facility. But in the second line, after recreation facility, it also included education facilities in the Minneapolis and Golden Valley ordinances. Hopkins did not include educational facilities, and so that was removed. The Minneapolis and Golden Valley ordinances, I believe, also made a reference in the examples to government buildings. This ordinance has an exception for government buildings, which is consistent with what the City Council did in 2020 when you adopted your first face mask ordinance. So we removed that language from this definition of space of public accommodation. So that's the definition. The requirement, the general requirement is that unless exempted, all individuals must wear a face covering in indoor areas accessible to the public within the city of Minnetonka. And then it applies to restaurants and bars, spaces of public accommodation, gyms, fitness facilities, and sports facilities. But there is an exception while a person is actively participating in athletic activities, which is one of the exceptions the City Council had specifically requested. It also includes the indoor entertainment venues, common spaces in multifamily buildings, and city buildings. Then employers in section 3.03, it requires employers of businesses to require their employees to wear a face covering when they have face-to-face contact with the public, unless there are other physical barriers in place. That, again, was a requirement in the first face mask ordinance that the city adopted. And it requires that notices be posted informing the public that these requirements are in place. Then it goes into exemptions, and the exemptions include other government buildings, personal care services and salons that already have face covering requirements. It excludes children 5 years of age and under. Some cities have gone as low as 2 years of age. This one uses 5. It excludes anyone actively eating or drinking, and has other exclusions. Again, these were consistent with the exclusions that were in the first face mask ordinance that the city adopted. Individuals that have medical disability or developmental reasons that they can't wear a mask, anybody who can't remove their mask without assistance, someone who needs to remove their mask in order to communicate effectively, participants in youth sports activities. It excludes places of worship, and it specifically excludes public and private school facilities. The public school facilities would have been excluded under the governmental exemption. We're just treating them the same, both public and private. Then in terms of enforcement, these are the enforcement provisions that the city had in the first ordinance that you adopted. What it states is that any individual who might attend, let's say, a grocery store, must be asked to leave by the business organization. And if they refuse to leave, then once they've been told that they have to leave, that's a trespass violation, and the police could come and cite the person or enforce the trespassing laws. If an individual claims that they are exempt due to medical disability or developmental reasons, the business can take their word for that and would not be required to tell them to leave. If an individual continues to refuse to comply, then that would be a violation of section 900.055, and it is a misdemeanor offense. Oh, you know, I apologize. There was an error putting this together. No, I'm misreading the bullets. Okay, and then lastly, they can be subject, any business that violates the ordinance can be subject to administrative actions for penalties. So then it also just includes recommendations. These would not be enforceable as violations, but recommendations that people also do hand washing and just good hygiene practices, and encouraging businesses but not requiring them to provide masks at no or nominal cost. The ordinance has a 61 date duration. As the city manager mentioned, the city council could set a shorter date than that. Oh, I am so sorry. I am looking at the 2014 ordinance. That's why everything seems so similar. I apologize. I went to the wrong page in the packet. That's why I was confused. It was like, I don't remember writing it this way. All right, I'm going to go, and I do apologize. I'm going to start all over. What I said before, the definitions, that is accurate. This space of public accommodation, these are the definitions that were in the other orders recently adopted. The difference in defining space of public accommodation is that it does not include any reference to educational facilities or government buildings. And then this does apply to individuals age 2 and over. Some cities have made it enforceable just as to individuals 5 and over. So that would be another thing that the city council could discuss. And then the requirement is that employers of businesses that are spaces of public accommodation are to require their employees, regardless of their vaccination status, to wear a face cloth covering, and then the exemptions. So this is very similar, but it is not identical to the last ordinance that the council adopted. The difference here, the exemptions are for athletes and performers while they are competing or performing, individuals who are actively engaged in exercise or a fitness activity at any indoor recreational facility, customers at a restaurant or bar when they are seated at the table or counter, anybody who can't wear a mask due to medical disability. And then again, government buildings are exempted and public and private school facilities are exempted. We did include the required signage provision. And then in terms of enforcement, the ordinance requires the business to tell the individual to leave if they're not wearing a mask. If they refuse to leave, then the person could be cited for trespass. Beyond that, a business that violates the ordinance would be subject to administrative action for any license that they possess. So a restaurant or bar holds a liquor license. Businesses hold food licenses. There are a variety of businesses. The criminal enforcement was removed. Other than for trespass, this does not include criminal enforcement. And the ordinance remains in effect for 61 days unless the city council shortens it. So I apologize for starting off with the wrong ordinance. I do have the correct one now, and I'm going to stop sharing my screen. And I will stand for any questions if you have those.
Council, any questions for Ms. Heine or for staff in general? Councilmember Wilburn.
I just have a question on the end date stipulation. Is it possible to set a 61-day date and then come back later and in the ordinance sooner than that, if the numbers indicate that we should?
Councilmember Wilburn, under the city charter, an emergency ordinance can only be in effect for 61 days. If the city council wanted to set a shorter time period, it could. If the council sets no other date, it will automatically expire in 61 days and could not be enforced unless the city council adopts a new ordinance and reinstates the ordinance prior to the end of that 61 days.
Councilmember Calvert.
Thank you, Mayor. In our last, in the meeting on Monday, we had a presentation on transmission rates. And, there were tiers. There was, right now we're in a high transmission phase. And there were, there was moderate and there were low. I think there were 4 different. And so what I'm wondering is, is it possible to reword it to tie it to transmission rates so that when we are down at the, getting down towards the low transmission rates when clearly things are simmering down, that we can just tie it to the science and how our hospitals are doing?
Councilmember Calvert and members of the council, yes, I could add language in there. Probably what we would do is include, rather than having it tied to the effective date of the ordinance or the duration of the ordinance, we might say enforcement would be suspended, or authorize the city manager to suspend enforcement of the ordinance at any time that the transmission rate for Hennepin County as and I believe that that's established through data from the Centers for Disease Control and Prevention. We'd have to reference the correct measure, but at any point that we were in whichever transmission category you designate, they have low, moderate, substantial, and high, and we are currently in a high transmission rate. We could tie it to that and basically just say the manager, city manager, has the authority to suspend enforcement if the transmission rates would drop.
Are there any other questions? Councilor Kirk?
Thank you, Mayor. When should we address inconsistencies between the 2022 ordinance and the one we're reviewing tonight? When would you like to review those? Specifically the age and the exemption for churches?
Well, I think you should get your questions asked. We're not doing comments now, so it's a little, I'm a little unclear to whom you're directing the question.
Maybe put it in a question then. Why did we go from 5-year-olds to 2-year-olds? And why did we exempt churches in 2020 and not in 2021 or 2022?
Ms. Heine.
Councilmember Kirk and members of the council, for the most part, the new ordinance was prepared using the most recently enacted declarations and ordinances in other cities. There were a couple of, so this is, as I said before, very similar to the ordinances and declarations adopted in Golden Valley, Hopkins, and Minneapolis. So we were trying to maintain some consistency with that. In terms of the definition of spaces of public accommodation, we went to, we followed Hopkins as our closest neighboring city. And obviously, if the council wanted to pick up any additional exemptions that were in the 2020 ordinance, that could be done. We were trying to mirror more recently adopted ordinances.
Councilor Kirk?
Second question, the inaction date when to put this into place, Mr. Funk had suggested the 17th, which is Martin Luther King Day. Does our staff work that day, or would it actually end up being the 18th one, to think about what date actually works better for staff?
Ms. Heine? Or Mr. Funk?
Well, I think I can respond to that. I think what Mr. Funk suggested was late in the day on Monday. This would be for it to be effective for the businesses that are impacted. And so the City Hall is closed on Monday. Most of the staff, other than, the emergency staff, are not working on Monday. It wouldn't have a direct impact on them, but we were trying to select a date that would give businesses a couple of days notice. And I think Mr. Funk also mentioned you could make it effective. It does say 11:59 p.m. That would essentially be Tuesday morning.
So, I want to set the tone a little bit here. We are going to be finished with this meeting at 5 o'clock. So I want everyone to monitor their time. We have 26 people who want to speak. They will each be given 90 seconds to speak. This meeting will be over at 5 o'clock. So please bear that in mind as you make your comments and consider. We know that we've heard from a lot of people, but this is a fairly straightforward matter. Let's hear from the public. Let's discuss it. And among the things that we will discuss are the effective date, if it's enacted, and the end date, if it's enacted. But each speaker will be given 90 seconds, and I'd like to get into public comment as soon as possible. So if there's a pressing question anyone has, please ask it. Otherwise, we're going to move into public comment. Is there anyone? Councilor Coakley.
Quick question. I know I talked to Mr. Funk earlier, and we talked about possibly looking at every 2 weeks where we're checking back in about the mask mandate if it passes, depending on the levels of transmission maybe looking at every 2 weeks, checking in to see where we're at. And so is that something that we can look at or include?
You know, the council makes the policy, so that is indeed something we could consider. All right, Mr. Dulac, we have callers, and could you please provide the instructions to the callers in terms of how they unmute their phone? And as I indicated, I've got a stopwatch here, and everyone will have 90 seconds. And when we get close to 90 seconds, I'm going to say next caller, and then Mr. Dulac will at 90 seconds will mute that caller, and we'll go to the next one. So we're going to keep the public comment moving along quite briskly, because we could spend a lot of time doing this. It's the Friday before a holiday weekend, and I don't think we all want to be here all night. So we're going to move it along, and we will finish at 5 o'clock. So Mr. Dulac.
Mayor, if we could have the public callers press *1 on their phone, that will queue them up in order to speak. So again, press *1 on your phone. And our first caller will be Delilah Puri.
All right, Delilah, Ms. Puri, please state your name and address and make your comments.
My name is Delilah Perry. I reside at 1900 Vernon Drive South. I'm an immunologist. I've been working in academia research and biotech for 2 decades. And I'm speaking to you against implementing any citywide mask mandates. Mask mandates were passed very quickly in neighboring cities based on the number of rising cases, despite data that's currently available on the mildness of this variant. The narrative now is less about illness severity, but about number of cases. And before you hit the panic button, I want to say that there's no reason to go back to these same drastic measures that have been proven time and time again and have to be failures. It's time to opt for a more efficient route, recognize the mildness of this variant, and recognize the limitations and false security that face masks offer. That's everything. Thank you.
Well, thank you so much. Thank you for being here today. Next caller.
Mayor, next caller is Sumner Jones.
Welcome, Mr. Jones.
Hi. Hello?
Yes, please state your name and address and tell us what you have to say.
Hi, this is Sumner Jones. My address is 4425 Tonkawood Road. Good afternoon, Mayor Wiersum and other city council members. I'm calling in today in opposition to the mask mandate that's currently being considered. The latest report, as of yesterday, from the Minnesota Department of Health shows that hospital admittance is decreasing, ICU admittance is decreasing, convalescence cases are decreasing, and deaths are decreasing. So forcing everybody to wear a mask will not have an effect, and it will only make it appear that the council feels an obligation to act in some way on an issue that's really already resolving itself. Furthermore, the CDC has recently updated its messaging on masks by admitting that cloth masks do very little, if anything, to stop the spread of COVID aerosols. If the council enacts a mandate and allows cloth masks, that would be unscientifically ignoring the current known data about cloth masks. It would be an admission that the council felt it had to do something, even if it was known that the action would have no effect. On the other hand, if the council enacts a mandate that only allows N95 masks, the entire population of Minnetonka would be terribly inconvenienced and will have to scramble to obtain N95 masks to comply with a mandate for a problem that is, again, really already going away.
Thank you. We'll go to the next caller.
Sorry about that, Mayor. Our next caller will be Karen Schletma.
Welcome. Please state your name and address.
Hi, my name is Karen Skeltema, 10551 Greenbrier Road, apartment 333. The last caller talked about cloth masks being ineffective. I agree 100%. I'm recently recovering from Omicron, and it doesn't seem to matter about what mask you wear. But I do say if you do a mask mandate, that the city is not be excluded. That's it.
Well, thank you very much. I hope your recovery continues well, and thank you for being here today. Next caller, please.
Mayor, next caller is Thomas Bone.
Welcome, Mr. Bone.
Hello.
Hello, please state your name and address.
Thomas Bond. I live in 1908 Welland Avenue.
And continue.
Yeah, I just want to say we've all seen this play out already. We've all seen with our own eyes. Everybody was wearing a mask a year ago, and it didn't seem to do anything. And if you need science to back up the fact that masks do not offer the protection that you're seeking, please go to maskoffmn.org and click on the masks tab at the top, and you'll find study after study showing the ineffectiveness of masks. And, not only that, you'll learn that prolonged masking may lead to several adverse side effects. I haven't changed one aspect of my life during this quote-unquote pandemic. I've worn a mask 3 times in 2 years. I have 3 young kids. They have not worn a mask once yet. We're all just fine. We live a healthy lifestyle. We trust that our God-given immune system will do what it was designed to do. Since the statewide mandate ended, haven't we been doing just fine, letting people choose what they want to do? A lot of people are wearing masks now. That's fine. Some are not. That's fine too. If you are scared, stay home. Let us go back to normal. And I just want to warn you, if this mandate does go into effect, I will be trying my hardest to take my business to establishments in cities that have opted to vote in favor of freedom. I will not be wearing a mask because I do not listen to communists.
Thank you. Thank you for your comments. Our time is up. Your time is up, and we will go to our next caller.
Mayor, our next caller is Mark Osley.
Welcome, and
Hello,
please
my name
provide
is
your
Mark
name and address.
Osley. Yeah, Mark Osley, 14303 Mount Terrace. I live in Minnetonka, and I'm a pastor at a local church that falls under the jurisdiction of Minnetonka. I first just want to say, may God lead you in your decision-making. As a church, we're at a busy intersection, and we frequently have walk-in visitors, and they come in because they're in some sort of need. Recently, we had a man without proper shoes come in from the bitter cold. And we help people regardless of their ability to comply with ordinances or social norms, whether they're leery of authorities or leery of vaccination. We often don't know their state of mind, and we have to talk to them and read their faces. And so as I'm seeing some of the other things coming out of cities, I'm going to ask for these specific things. If you create a mandate, please don't put the strain on staff to enforce the mandate. Also, please don't discriminate against people who are unvaccinated. And I'll ask that you please exempt houses of worship. Please, essentially don't let a mandate limit help to those who are most in need. Thank you.
Thank you for your comments. Next caller.
Mayor, next caller is Jenna Bond.
Welcome. Please state your name and address.
Okay. My name is Jenna Bond. I live on 1908 Welland Avenue, and I am calling to express my opposition to a mask mandate. I'm an advanced practice registered nurse at a facility in the metro, and I have worked on the front lines for the last 2 years. And there is no research that is supporting healthy people wearing masks. In fact, most of the people that I've seen in the hospital have multiple comorbidities. So making those of us that are healthy go about our daily lives infringes on our right for informed consent to make healthcare decisions for ourselves and for our family. And like another caller said, if a mask mandate is imposed, I will take my business elsewhere in cities that haven't imposed a mandate. I just can't stress enough. I've been on the front lines. I've seen this pandemic the whole time, and I strongly oppose in implementing a mask mandate.
Well, thank you for your comments.
Mayor, our next caller is Dee Long.
Welcome. Please state your name and address.
Thank you. My name is Dee Long. I live at 249 Willoughby Way East in Minnetonka. My husband and I are 82-year-old residents of Minnetonka, soon to be 83. We are careful about our health care. During this particularly difficult time of COVID, we're triple vaccinated. We wear easily obtainable N95 masks. But for our own physical and mental health, it's important that we not be locked up in our house in isolation during this period. I go to the library, the Hennepin County Library, where masks are required. I shop for groceries in Minnetonka. We go to restaurants in Minnetonka. I, again, urge you strongly to adopt an ordinance so that people like us can feel secure and safe when we go about our daily lives. And indeed, people have talked about taking business elsewhere. I guess, if you don't, I can get groceries in Hopkins. Yeah, I can get groceries in Golden Valley. We can go to those restaurants, and we will certainly do so, and we will pass messages on. Old people like us have a lot of time on social media, and we will be passing the message along to others. Again, I thank you very much for your consideration, Mr. Mayor and council members. Thank you.
Thank you,
Do the
Ms.
right
Long.
thing for your constituents.
Thank you.
Our next caller is Maria Allers.
Greetings. Please state your name and address.
Yep, Maria Ehlers, 5537 Woodland Road. And I just wanted to talk a little bit about underrepresented members of our community and how the mask mandate might affect them. I'm a speech language pathologist. I've worked with people over the years who have had a difficult time communicating, and I can imagine so much more with the masks on. I'd like just to amplify their voice and show how certain groups could be impacted. So people with dysarthria, so for example, Parkinson's disease, they have muscle weakness and it affects their ability to speak loudly. With a mask, you need to speak louder and for longer to be heard and to be understood. People who are neurodivergent, such as people with autism, they may have tactile sensitivities and can't tolerate fabrics or tags or textures. So for them, a mask is a big problem. Lots of people who wear hearing aids have trouble wearing a mask with their hearing aids because it interferes and it makes static for them. Cochlear implants and people who rely on lip reading are disenfranchised because they aren't able to see and see facial expressions and also read lips. And lastly, my specialty, children with articulation errors and language impairments. Children, especially those vulnerable children with language impairments, they learn from looking at people's lips and seeing how sounds are formed, and they are at a huge disadvantage having to wear masks. So I just wanted to thank you for taking into consideration Minnetonka residents who may be harmed by the mask mandate in ways that you guys did not think. Thank you so much.
Thank you. Next caller.
Mayor, next caller is Mary Ross.
Good afternoon and welcome. Please state your name and address.
Hi, my name is Mary Ross, and I live at 3978 Van Dan Road. I want to add my name to the absolute support of this local mandate. I think it's absolutely critical. Two supporting points. First of all, I will only shop where it is posted. I respect the businesses that ask for this as on their doors, even without the mandate, whether it's Target or whoever else. That's where I will shop. If we don't, I will not go into businesses that don't put signage up there. I simply don't. But more importantly, I want to say that I do have someone in my family who works in the retail environment, and it has been a horror story for the people who do work on those front lines, and they are treated with great disrespect and themselves are often at risk. They are put down as the enforcers. So what I would hope is, if and when this is passed, that we also articulate the details of what you've shared as in communication out to businesses. I think it takes the onus off a business to simply say that there's a trespass violation if you don't comply. So I ask you to not only adopt it, but to be very careful and very supportive of the workers with how you communicated. Thanks.
Thank you for your call and have a good day. Next caller.
You too.
Mayor,
Thanks, Brad.
Mayor, our next caller is Drake Lawrence.
Welcome, Mr. Lawrence. Please
Hello,
provide your
my
name
name
and
is Drake
address.
Lawrence. I live at 13555 Essex Place. Lived in Minnetonka for 40 plus years. I would just ask the council, I submitted written comments of a chart on the Minnesota Department of Health data, which shows the date when the state of Minnesota mask date was enacted. And as you work through that, you'll see that COVID cases actually increased after the governor's mandate. And then once we took them off, they actually fell. And at that time, Minnesota had one of the best mask wearing rates in the nation throughout the period. They had a 90+ compliance. But because our time's limited, I'm concerned about our businesses and commercial real estate owners. They experienced extreme duress during this period. They lost tenants. They lost their smaller businesses, and now they're just recovering. And to reinstate masking now, while adjacent suburbs do not, it's only going to hurt our Minnetonka businesses, because a bunch of Minnetonka residents will just drive the extra 5 minutes to another community. And this is eventually going to trickle down on property tax, because commercial real estate, the way the formulas work, their occupancy that they drop, their rents are going to be less that they can charge. And then I would exempt daycare.
Thank you, Mr. Lawrence. We're running out of time.
Mayor, our next caller is
just
Chris Fields.
Please state your name and address.
Thank you. Chris Fields, 2354 Cherrywood Road. And I should say Major Chris Fields retired. And I can tell you this ordinance amounts to nothing more than a hostile takeover of American freedom and liberty. I have the right to choose for myself how I want to protect myself and my family. This is not based on science. You've heard the callers. They are all right. The mandates do not work. If this ordinance is passed, this is the city council saying, hey, we do not believe that individuals are smart enough to protect themselves. And we are smart enough to protect ourselves. We can't let them die here. America is special. Minnetonka should be special. Just going along with, oh, well, I'm going to copy paste what Hopkins did. There's so many exemptions in this ordinance. It looks like Swiss cheese. And we're talking about COVID. COVID's microscopic. I'm passing cloth masks. So we're not doing anything. We're not doing anything other than making a political decision just so a body can say, we did something. You guys will never accept responsibility for anyone's death as it relates to COVID, nor will you ever pay the economic costs associated with all of these mandates. People are furious because we're tired of being told what to do. From the airplanes, airports, shopping, we've had 2 years of this. Give it a rest, please. Thank you.
Thank you for your comments. Have a good day. Next caller.
Our next caller is Susanna Nelson.
Welcome, Ms. Nelson. Please state your name and address.
Susanna Nelson, 16101 Kensington Court.
Go ahead.
So we're in the middle of a massive labor shortage. Everywhere you go, there's now hiring signs. Businesses are struggling to hire staff, and they're even cutting down their hours because they don't have enough staff. So is it really good timing to be enforcing a mask mandate that they have to enforce? And if this is truly about public health, are we going to require only N95s? And then how are businesses supposed to enforce that? Like asking if your mask is compliant, fitted correctly. And also, as a mom myself, a huge concern to me is you're doing 2 years old and up. Walls did not even go that extreme. Are you really asking businesses to discern in the moment if a child is 1.5 versus 2? And are we supposed to bring around birth certificates to prove to, Joe at the local hardware shop that my child is the age I say she is? Just lastly, last week you said there was a school board member who approached you, and with all due respect, I think school board members need to stay in their lane. If they don't get something passed in the school board, they need to work that out on the school board. The city council is not a big brother for the school board to run to when they don't get their way. Thank you.
Thank you so much. Next
Mayor,
caller.
I need to remind our other public callers, if you haven't queued up, please press star 1. Our next caller is Tom Madden.
Good afternoon and welcome. Please state your name and address.
My name is Tom Madden. I live at 19260 Lake Avenue. Can you hear me?
We can.
Hello?
Yeah, we can hear
great.
you.
I'm a small business owner. I'm a small business owner in Minnetonka, and I can tell you, based on past experience, you will absolutely destroy my my business. Last time I had to let 4 people go. I only have 8 people working for me. Those 8 people, 3 of them were out with Omicron in the last 10 days. All 3 are back. It's a 3-day flu. No one should be surprised by the increase in Omicron, as stated by Dr. Navarro and Dr. Malone. Those who don't know who Dr. Malone is, he's the grandfather of the vaccine policies. He stated back in April, we're going to have an upsurge. The virus will mutate like all viruses do, like colds do, which we don't do any of this for a cold. But they said back in April, it will mutate. It will spread like wildfire. It'll be a 3-day to 4-day flu, and we'll all move on, which is exactly what's happening. The other point I would like to make is if you want to follow Dr. Malone, you did a 3-hour interview on Joe Rogan. I've been following for a year and a half. I've also read over a dozen studies on the masking policies going back prior to COVID. This is going back before any of this happened. You read through those studies, it is crystal clear. Masks do nothing to protect people. In fact, if you're objective about it and you read them, you will
We're
learn
out of time.
that.
We'll go to the next caller.
Oops. Mayor, the next caller is Mosh Perry.
Welcome. Please state your name and address.
Moshe Perry, Vernon Drive South, Minnetonka. I just want to remind the mayor and the council member that you're here to serve the entire people of Minnetonka. So right now, if I don't want to wear a mask, I don't want to wear a mask. If someone wants to wear a mask, he can wear a mask. If you pass this mandate, I don't have an option to walk without a mask. So you guys forcing me, and that's not why we're here. This is the land of the freedom. Don't force anybody. Thank you.
Thank you for your call. Have a good day. Next
Mayor,
caller.
next caller is Brianna Bears.
Welcome. Please state your name and address.
Brianna Burrs, 4656 Caribou Drive. I am calling in support of the mask mandate, and also to reiterate that it's not just about you that you're wearing the mask for, it's others around you that are vulnerable and that need help fighting off all of this. And the sooner we can get it done with, the sooner we can be done with it. Thank you for your time.
Thank you so much. Have a good day. Next caller, please.
Mayor, our next caller is Rachel Amison.
Good afternoon. Please state your name and address.
Rachel Amundsen, 3432 County Road 101.
Go ahead.
Yeah, I wish that we could go back to making decisions as an individual, and we decide as parents of our kids and our families what is best for our family, and the government not telling us what we have to do and we don't have a choice. Not only that, but our family does not go places that enforce this mask mandate. We don't take our kids into a world where all they see is masks covering a face that don't even work. There's a million bajillion facts out there that state why they don't work, and there's stuff to back that up. But I don't need my kids thinking that's a normal world and just what it's doing to mental health around us and the isolation it's creating in our kids and in our schools and in our communities. And so because we won't support that, we refuse to wear them, those businesses are losing our business, not because we don't agree with their business and we don't want to support them, but we're not going to support this mandate. So it's time to let the people choose and let America have our freedom back.
Thank you very much. Have a good afternoon. Next caller.
Mayor, that is all the callers I have in the queue right now. There are, according to our list, about 8 other callers that still need to speak. So if they can please press *1, I can get them in the podium here.
Very good. We'll give you a minute to make that happen. And I'll ask Mr. Funk, is there anyone in the council chambers who's come in to make a public comment?
Thank you, Mayor and Council. We do not have anyone present.
All right. And Mr. Dulac, has anyone else signed up, or has anyone else shown up?
Yep, I do have Brandon Bogus.
All right. Welcome, Mr. Bogus. Please make your comments. State your name and address.
Brandon Bogus, 4815 Hamilton Road. I'm a certified registered nurse anesthetist, also referred to as an airway expert in the medical profession. I've been at the forefront of COVID-19 since the beginning and base my actions in responding to the pandemic on data, not emotions or politics. I'm here to explain why I believe the mask mandate is unjust and ineffective. Because we are making decisions for COVID-19, it's vital that we make these choices based on the best available data. Currently, there's 2 primary worldwide studies available which focus on the efficacy of cloth and surgical masks, ability to filter aerosolized particles like COVID-19. In the first study out of Waterloo, Canada, they concluded that these masks only can filter about 10% of exhaled aerosol droplets. The second and largest study out of Bangladesh with over 350,000 people simply concludes that cloth masks do not reduce the transmission of COVID-19. The important detail between these studies is that they're both on the Alpha variant, which the second variant was the Delta, which is 2 times as transmissible, and now the Omicron variant is 140 times more transmissible, meaning that these cloth and surgical masks offer even less protection. Even states with the strictest mandates, they did not have a reduction in cases, and cases are an arbitrary measurement on the severity of population risk. No one counts the cases of common cold or influenza.
Thank you for your report, but we're out of time, so let's go to the next caller.
Mayor, the next caller is Carmelia Ramos.
Welcome. Please state your name and address.
Good afternoon, everyone. My name is Camelia. I'm a Minnetonka school parent. I'm calling because I'm concerned about the spread of COVID in our schools and community at this point. The infection rate in Minnesota is higher than ever been since the pandemic began. This surge is also seen in our schools. The active cases in Minnetonka schools have nearly doubled from 316 last week to 609 this week, and it's still growing. I understand City Council is considering mask mandate, and many of us strongly request to include the schools because any mask mandate that neglects our schools ignore a high source of spread in our community. Last Thursday, during the Minnetonka School Board meeting, the district shared results of a survey completed by teachers, parents, and students, which I will be sharing. Universal masking had the highest support of all the elements in the state learning plan. The update on the school mask mandate was in the agenda to be discussed in the meeting, but our school board chose to postpone the discussion even though our schools are already experiencing interruptions and closures due to COVID spread. For example, the Minnetonka High School had to go to e-learning the very next day because significant numbers of staff were out due to COVID-related issues. As of today, all middle schools and high schools had to go to distance learning or hybrid model to end the semester. This COVID spread is very urgent and needs to be addressed immediately. We need your help to include the schools in mandating masks to slow the virus spread and keep the community safe and functioning. There are 2 petitions I have shared with I didn't get the last name, Mr. Kyle.
All right.
2 petitions currently circulated.
But your time is up. Your time is up, so we'll go to the next person. Thank you.
Mayor, next caller is Bill Anderson.
All right, Mr. Anderson, welcome. Please state your name and address.
Essex Road, Bill Anderson. Yeah, if masks do work, let's assume they do for this discussion. I don't need someone else to tell me to wear a mask. I would welcome if I felt strongly about wearing a mask and I felt someone else should wear one as well. Why don't I just wear theirs for them? That way, they don't need to, and I don't need to enforce my will on them. That suits everyone, and everyone who wants to mask is well protected, and those that choose not to don't need to be told what to do by a city such as Minnetonka.
Thank you.
Mayor, the last caller I have in queue is Lisa Lamoureux.
All right, Ms. Lamoureux, welcome, and
Yep.
please provide your name and address.
Good afternoon, Alyssa Lamoureux, 10613 Custridge Drive. I just wanted to note my opposition of the mask mandate. You know, this has been going on for 2 years. Clearly, the mask is not changing the equation here. You know, I have 3 young kids. They have not wore a mask other than on an airplane, which they did not even get enforced to wear. That this is ridiculous that we have to even consider this. This is all theatrics at this point. If you want to wear a mask, go ahead, do it. If you want to wear 5 masks, go ahead and do it. But don't tell everyone else what to do in the city of Minnetonka, let alone anywhere as we move throughout the U.S. On top of that, as everyone else has reiterated, you know, the CDC has said, you look around and a majority of people are wearing cloth masks. They don't work, especially. So unless everyone wants to strap on an N95, just forget this whole mask mandate and let's move on. Until we all stop the narrative of let's run out and get tested when we get sick or feel symptomatic, we are not going to change the narrative here. We're going to sit and do insanity. Let's bang our head against the wall and get tested and know that we're sick and wear a mask and do all these things. We can stop COVID when we decide we want to stop this at an individual level. It's going to be around, and nobody's going to stop COVID from completely going away. A mask is not going to do that.
Thank you for your comments.
Mayor, our next caller is Ricky Brown.
Welcome, Mr. Brown. Please
My name is
provide
Ricky
your
Brown, and
address.
My name is Ricky Brown, and I live at 10521 Cedar Lake Road in Minnetonka. So I think the citizens in the business community here in Minnetonka can think of public health and the spread of COVID being all about lockdowns. And we really don't like nor want lockdowns. It is with that understanding that I support and urge council members to vote to put a citywide mask mandate in place immediately. In fact, I strongly suggest that you consider putting a Minnetonka citywide data-driven mask policy in place. This is, in my opinion, or would, in my opinion, be best in terms of addressing the rise of surge of COVID cases, both now and in the future. That way, as we see a rise or surge in COVID cases, such a policy can be enacted during surges where students wear masks for sure and other citizens in public places. So understand that wearing masks are all about coming together to make sure that no one person spreads, COVID in a room. So I strongly urge that the council pass this mandate and consider a data-driven one. Then that way, whenever these numbers go high, we're able to act because we know this.
Thank you, Mr. Brown.
The key
I
is
think
to
we're
prevent.
at time.
Yep.
We're at time. So thank you for your comments.
Mayor, our last caller is Lauren Gomez, and then we have one person in the council chambers.
Very good. So we'll go to Mr. Gomez first and then to the council chambers. Mr. Gomez, please state your name and address.
Hello, I'm Mrs. Gomes, and I am a Minnetonka resident and a mother who is adamantly opposed to this mask mandate. I ask that you let every member of our community continue to have the freedom to choose to mask or to choose to smile and greet others, to facially express kindness to children in a crazy and scary world. My husband and I decided that Minnetonka would be the best place to raise our young family. We bought here and have invested immensely into our community. We had planned here to be here forever. For the past 2 years, we have felt suffocated. We've had to take our children out of Minnetonka schools due to the masking mandate. We thought we would return to our neighborhood school later, but masks are still required, so we are still not welcome. We've had to find an excellent alternative. As a mother, I cannot stand by and have my children live amongst constant fear. The masks scare them. My parenting goal is to give my children as normal of a childhood as possible during these crazy times. Excuse me. With all that has gone on in Minnetonka and Minnesota, we no longer feel welcome. We no longer believe that this is a good place to raise a family. We sadly are strongly considering moving away. I hope that each of you please consider how much I value my children being able to see me smile and greet others as we are out and about in our community. I must show my children joy and bravery because the world no longer does.
Thank you, Ms. Gomes, for your comments. We will now go to the individual who is in the council chambers.
Eden Prairie. I have vested interest in Minnetonka community. I am asking Minnetonka Council to consider this very seriously based on sound information. There is no good information, as stated before, that cloth masks do prevent any spread of the disease, and it is not correlated with the rising incidence nor the increased hospitalizations. So that information needs to be considered very carefully. In fact, as stated, anecdotally, there is information out there that proves that cloth masks actually increase health risks, whether it's mental, social, or physical. So all this information needs to be clearly and deliberately considered when making this decision. Thank you.
Thank you. All right, so Mr. Dulac, no more callers, and we're done with public comment. So
Mayor, you are correct. There are no further callers.
All right, so I don't know if I ever really opened the public hearing, but I will close it. And we've got about 25 minutes to do our business. And I think there are 3 items before us. One is yes or no on a mask mandate. And we discussed that at some length in the earlier part of this meeting. That was last Monday. Then if it's the council's desire to pass a mandate or not, we have to decide when to start it and when to finish it. And I think, again, to be respectful of time, we're going to try and do that all in the next 20 minutes. So, Mr. Funk, do you have anything to add, or otherwise, I think council can make their comments, and let's organize our thoughts on. I'd say let's try and decide yes or no first, and then if it's yes, we can vote accordingly, and then if it's no, it's a moot point. But maybe, Mr. Funk, you would like to just review the alternatives we have before us one more time.
Yes, thank you, Mayor and City Council. You summarized that well, and I'll just reiterate a couple things. So I think you're correct. The first, I would recommend your first discussion be about whether you want to approve the ordinance or not, and then if the answer to that is yes, there are a couple discussion points that will need to be further clarified. One will be, as you've already noted, Mr. Mayor, is the start date, and so we'll need to clarify that in the ordinance. Also is the expiration date. So those are 2 items. And then last, we want to confirm, I think, the school district, whether there's interest to exempt the school districts. As Ms. Heine mentioned earlier, school districts are currently exempted in the language, and so if the council wishes to deviate from that, that would need to be discussed as well. And then if there are any other exemptions the council wishes to choose, those 2 would need to be added to the ordinance. So that is the first discussion, and kind of part 2 of that is then the clarifying points I just mentioned. And then last is if there is consideration then for the other option, and that is the resolution. So Ms. Heine did prepare a resolution. We didn't spend much time introducing it or going through the points. Again, that's very similar to what we've seen in Edina and Bloomington, and that's a more of a strongly worded encouraging mask wearing versus the mandate. So with that, I'll turn it back over to you, Mr. Mayor.
Thank you, Mr. Funk. I trust that the council members have read those documents, so we know what we're talking about. So what I'd like to say is, again, we want to move along efficiently. So let's not turn this into a debate. If anyone has any comments, I would like them to make them. In the interest of time, I will only recognize each council member one time as we discuss this. So organize your thoughts, make your statements, and then we'll try and bring this to a head. And then if there are other items to be considered after we vote on the ordinance, then we will fill those in. So who would like to comment first? Councilmember Shack.
Thank you, Mayor. And in the interest of moving things around, I've been preparing some notes, so I'll try to keep it very brief. I've been a part of difficult decisions, and this has garnered more community input than any other issue I've been a part of. It looks like a lot of commentary, emails, text messages, which I don't personally appreciate, and voicemail messages from people in Minnetonka, but a lot from people outside of Minnetonka, and a lot from people sending 3, 4, 5 email messages over the course of this week. Obviously, people on both sides feel very passionately about this. So I felt I did a little work on the backside. I felt I needed input from maybe a more dispassionate perspective. I reached out to 6 or 7 residents of Ward 2, some neighbors, some folks who have engaged in city discussions related to other issues in the past, who I believe have a good, trustworthy perspective. In other words, not people in my close circle. The response was split, but most people came down in favor of the mandate, only wavered because they were concerned about enforcement, not because they don't support masks. They in fact said if you decide to enforce or implement a mask mandate, they would be encouraged about that. And because we only heard from a couple consumer-based businesses, I reached out to 3 businesses in the Ridgedale West Ridge area, a restaurant, a device repair shop, and a financial advisor with a retail-facing space. All 3 were, surprisingly, I didn't know where this was going to come down. All 3 were enthusiastically supportive of masking, and for really 3 reasons. They want to keep their employees safe and keep their stores open. They don't want their employees to get sick and have to close for a week. They think that the city mandate reinforces and gives them enhanced authority and gives their employees enhanced authority for asking customers to wear masks. One business had a mask mandate. They had to withdraw it because they just were getting too much pushback. They feel a city mandate would help them with that. And then also they all indicated they recognized they could lose some business due to masking, but also acknowledge that they may gain customers from other cities because Minnetonka does have a mask mandate. They also said one of them said, losing a couple of customers is better than closing for a week because their staff is sick. I went to our strategic priorities and I'm finishing up. And our safe and healthy community says, develop programs, policies, and procedures that enhance the community's well-being. I think this mask mandate does that. I believe it's a narrow mandate for a limited amount of time, and I support the mandate as drafted by staff with the exclusions included, and I support the recommendation that it be implemented essentially Monday at midnight. I realize this is going to be applauded by some people. It's going to be extremely unpopular with others, and I respect that. But I have one final comment, which is I'm really disappointed by the emails and messages that indicate that people are worried about the impact on businesses, but then go on to say, despite that concern, they're going to refuse to support the businesses in Minnetonka who are not the ones that are making the mandate. So I would encourage everybody, put a mask on, continue to support the businesses, and express your outrage about this vote at the ballot box in 2 years when those of us who are potentially up for election then run for city council. Don't take it out on our small businesses. Thank you.
Thank you, Councilmember Shack. Other comments? Councilmember Kirk.
Thank you, Mayor. I support the mask mandate. I'd like to make 2 changes, though. I think we should go with 5-year-olds instead of 2. And I'd like to see us exempt churches. I think they can make their own decisions for their congregations and synagogues. I understand the debate regarding the mask mandate. I understand the confusion regarding masking and especially cloth masks. I want to remind everybody that the data actually shows that it slows the velocity at which you exhale what you're expelling. And this particular variant that we're dealing with right now, you can walk around and be asymptomatic and not know it. At the same time, we have people in our community that have immune deficiencies. I have a niece that's going through chemo. She's probably 35 to 40% effective in her vaccination. I've got a friend that's dealing with taking anti-rejection drugs because of a kidney transplant. These people need to avoid contracting COVID at all costs and get through this. And it takes both of us to be wearing masks for cloth masks to be effective. Granted, surgical masks are going to improve that. Doubling up makes it even better. Those people that need to protect themselves from COVID need to wear N95s. But in order to be able to go out and shop and take care of your daily lives, we all have to be wearing masks for that to happen, which is why I support the mask mandate this evening. I agree with so much that Councilmember Shack had said. I won't repeat that. I do hope, though, that more people do come into Minnetonka for businesses after this mandate goes into place. Thank you, Mayor.
Thank you, Councilmember Kirk. Other comments from anyone? Councilmember Wilburn?
I'll try to be really quick. I want to let everyone know that we did read all your emails. I saw everyone's voicemail, and I did seriously, I promised someone through a phone conversation that I would seriously consider the points that he was making. And I have done that. I've been thinking about pretty much nothing else for these few days. But I come back to two things. One is that, yes, the Omicron variant tends to be less severe, but it is so infectious that we are overloading our healthcare system. And that puts not just people with COVID at risk, but somebody who has a heart attack, a stroke, a life-threatening injury. In some cases, we're talking days to get seen. So that is why we're talking about the mask. And Councilmember Kirk made points about cloth masks or the effectiveness of cloth masks. I will just mention quickly one thing that everybody seems to forget is that the exponential growth rate. So when you see, a few people infected on day one, by day 30, that's hundreds, thousands, even more people that could be infected. And the reverse is true. If we stop 2 people from getting infected, we're potentially stopping that many from flooding our hospital systems. So for that reason, I am in favor of the mandate.
Thank you, Councilmember Wilburn. Who else? Councilmember Coakley.
Thank you, Mayor. I just want to say I'm in favor of the mask mandate. I also was in favor of the school. I know that no one really is in favor of that, but one of the things I've been hearing from parents is that they wanted to implement the mask mandate, as we heard from the resident who lives here, who stated that her school, Minnetonka schools, has increased numbers in COVID, and they also went to social distancing. So as well as other schools, Hopkins, my daughter went to homeschooling today as well. And so the numbers are increasing in the schools as well. And I still say that anything that happens in a school also impacts in our community. And so I support both. Thank you.
Anyone else? Councilmember Calvert.
Thank you, Mayor. I appreciate all of the comments from my colleagues and agree with them. I also want to thank every member of the community, whether I agree with you or not. We all care about our community. We all want to do the best and make our community livable. We might just have different ways of getting there. And I want to assure everyone, even though at some point I couldn't respond, that I have read every email, every text, and listened to every phone message. So thank you for making your voices heard. I am not trying to end COVID. I don't think anyone here thinks we can. We're just trying to flatten the curve to give our hospitals and healthcare system a chance to take a breath and take care of people that have very serious medical needs. Our hospitals are overrun. We only had 13 ICU beds in the whole state last week. There was an article in the Star Tribune just 3 hours ago talking about the exponential growth of non ICU cases. So ICU cases seem to be subsiding somewhat, but the healthcare system is still overrun. And deaths are not the only metric that I measure public safety. My job as a public servant is public safety is number one, and that includes public health. And there is more than just Omicron out there. And so people are getting severely ill. And the pandemic actually can attack your pancreas, and it is causing diabetes to go up in children. And so I really want to protect our children. So that said, agreeing with everything that everyone said, I feel it's a responsibility to do my best. Oh, and also people that are asymptomatic, it's the people that are asymptomatic that are breathing out. The people, everybody has to wear a mask because you don't know if you're infectious or not. And it's the people that are breathing out that cause the infection. And it's hard for people to protect themselves, even with a mask, if the virus is aerosolized. So I'll leave it there. I'm in favor of the mask mandate with the exemptions. I actually agree with Councilmember Kirk. I think it's exceedingly difficult to get very young children to wear masks. So I would go with the 5-year-olds. And I actually also support exemption for churches.
Councilor Sheppy.
Mayor, thank you very much. First, I want to thank the community for all the time and effort they put into many emails, text messaging that I welcome. I welcome text messages. I welcome phone calls. That's democracy. And so that's how it works. So don't sign up for this if you're uncomfortable with being texted. I mean, honestly, we're here to help people. I'm voting no today, and I'm frustrated. Our community is at least 3-1 or higher against this. After taking out emails from people who are in Deep Haven or trying to jump in on the bandwagon, that's clear. It's clear from the phone calls today. It's also clear from the emails. It's not supported by our overall community, and I believe that's what we're elected to do. I'm not a public health expert. I'm not here to weigh in for what the governor could be doing. If we had a huge problem, that is the person who has the experts advising him on what to do on a daily basis. There could have been, going back a year ago, we had daily press conferences. Here are the numbers. Here's how we're doing. That's not going on. You know what happened this last week? The opposite. We had the governor relax quarantine periods for childcare centers. I have 2 daughters in a childcare center, operating just fine. They went from having extended quarantines to a close contact with no quarantine. This is Governor Walz's state government that actually has public health experts advising him. So our state, and it doesn't have to do with the other party. This is the executive of the state making these decisions. So my feedback is 2. Number 1, this is the governor's call. They have all the data. We're not medical experts. Number 2, our neighborhood and our community are not in support of this. I also called disinterested people, including on my block. Hey, what do you think? No, they're not in support. We may have difference of opinion on different parts of town, but in Ward 3, they're not supportive of this. And there are people who voted for me that'll probably be disappointed that I'm against this. And I welcome them and listen to their opinion, and that's democracy, and we'll have to move on. But I just can't in good conscience support this given the amount of people who have told us no. I've also talked to businesses in the area, the strip mall near me in Ward 3, Ridgedale, long phone calls with folks there. They're not in support. So it's not as clear, I think, as presented by council to date. The emails are the public record. I don't need to say the total number, what they are, the math. The record speaks for itself. I spent a lot of time reviewing it. I'm frustrated we're here, and I respect my council's feedback, but what we're doing tonight is not the will of Minnetonka. It's some small minority that has a loud voice that is now turned into the majority. So I'll be voting no, and I'm frustrated.
Thank you, Councilmember Sheppy. Well, a couple of comments. I appreciate all of the public input. I appreciate the passion. I do recognize that a lot of the communication we had did not come from within Minnetonka. It was amazing how many people did not want to put their home address down on the emails. And I will tell people that when I receive an email from somebody that does not contain their address, I discount it. Do I totally ignore it? No, I won't say ignore it. Some people say, well, I'm a Minnetonka resident, and then they don't provide their email address. I mean, do you think we are that stupid? Please, if you want to be taken seriously when you communicate with me, include your name and address. It's common courtesy. So that's one thing. I can count heads pretty well. When you're the mayor, that's what you have to do. You have to count heads, and I can see where this is going. So I do want to move things along. My vote, I stated my opinion the other night that I support wearing masks. I think it's important. But I also think that mandating masks, a mandate that will not be enforced, let's be honest, it will not be enforced actively by Minnetonka police. Now, if a confrontation about masks escalates, yeah, the police will be called. But the police will not be will not be enforcing this, and this puts extra stress on our officers, because just because it's not going to be enforced doesn't mean that the expectation of enforcement won't exist among people. So therefore, we're going to create more problems at a time when police officers are under particular duress. Some are out with COVID, and there's a lot of issues in police departments now. And so now we're going to give them something extra that they can be ineffectual at, because they're going to be the expectations of the public and what they are going to do are going to be two different things. That's not a positive. So my vote's not going to change. This is going to pass today 5-2. So let's move it forward. This is a 5-vote item. It requires 5 votes. I'd like to ask a council member, I think there have been some suggestion for changes. We have an ordinance in the packet. I would like someone to make a specific motion with a start date and an end date, and let's try and get this done as efficiently as possible. Regarding schools, I think it's important for cities to stay in their lane. And, there are places where school districts' business and our business interacts, and I think that's good. But if we start making policies for our school districts, which are not fully contained within our city, there are a lot of Minnetonka School District schools that are outside of the city of Minnetonka. There are Hopkins School District schools that are outside of the city of Minnetonka. And there are no Wayzata School District schools that are in the city of Minnetonka. If we start thinking that we can get out of our lane and tell school districts how to do their business, then we probably should not run for re-election, because that's really bad policy. So I'm going to vote no, because I don't think this is a good policy decision, but I respect what my council members have said. And I also will say that I think wearing masks is critically important. I think people should do the right thing, not because there's a mandate, but because it's the right thing. We need to end COVID. We need to be positive. We need to work together on that. And I think that we're all united in that. Maybe a little different on the tactics, but I think we're all united that we want to do everything we can to fight COVID. So if someone would make a motion with those specifics, maybe we can move forward.
Mr. Mayor, this is City Manager, Acting City Manager Funk. May I have just a brief comment, please, before you ask for that motion?
Yes. Yep.
Sorry, Mayor and Council. I hate to interrupt your before you take action, but just want to mention one thing to you. So on page, I'm looking at the packet on page, I apologize, on page 34 of 37. So there's the duration. So I just want to mention this, and talking with City Attorney Corrine Heine, just in terms of the expiration date. The current language in the ordinance states the ordinance will expire 61 days after its effective date. Ms. Heine has suggested language that I'd like to share with you because I think some of you had mentioned perhaps looking how that expiration date would mechanically work. And so the suggested language for your consideration, and this would be part of your motion if you so choose, and that is the acting city manager is authorized to suspend enforcement of this ordinance at any time that the level of community transmission of COVID-19 within Hennepin County, according to the Centers for Disease Control and Prevention, is at a level of substantial or lower. So that would allow the ordinance to be in effect for 61 days, and then that authority would be provided to myself as the acting city manager using the metrics, and then once we got to that level, then I could issue the halting of the enforcement. And if I see Ms. Heine's jumped on the line, so perhaps she has some clarity to what I just mentioned.
Ms. Heine.
Mayor and members of the council, that would be added at paragraph 3 of section 3.06, which deals with enforcement. So there's 2 paragraphs there for enforcement, and then the 3rd paragraph would state that the acting city manager is authorized to suspend enforcement. The ordinance would remain effective because the acting city manager can't terminate the ordinance. He can suspend enforcement of it.
Council, any concerns about that? Councilor Shack or Councilor Calvert?
Thank you, Mayor. I would like to have it be at moderate or lower. Substantial is substantial. So I'd like to see it at moderate, but that's just me. So.
Well, I'm in the interest of a compromise here. I'm fine with as recommended, but I also think that we could request the acting city manager to have us get a report every 2 weeks or every time we have a council meeting, put a finger on the pulse. And if we want to make a change, we can make a change. But I'm good with substantial because that is well down from where we are. That's one person's opinion, but I don't know how other people feel. I think having a finger on the pulse is a good idea. Councilor Shack.
Thank you, Mayor. I agree with what the suggested language, and I agree with your recommendation that we've been getting some updates in the past, and I think it's helpful to get those as long as we have this in place, and we can adjust accordingly then, or instruct city manager Funk to do that.
All right. I think I'm getting some thumbs up on that. Would someone like to make a motion? Councilor Shack.
Thank you, Mayor. I'll make a motion to approve the proposed ordinance as drafted and with the amendment just recited by Ms. Heine with the following changes: changing the age for children to 5 years old and exempting religious institutions.
Is there a second? Councilor Kirk?
Thank you, Mayor. I'll second that.
All right, we've got a motion by Councilmember Shack and a second by Councilmember Kirk. Mr. Szilagyi, please call roll.
Sheppy?
No.
Coakley?
Yes.
Kirk?
Yes.
Shack?
Yes.
Wilburn?
Yes.
Calvert?
Yes.
Wearsome?
Yes, motion carries. So thank you all. We had the opportunity. I know that we've made some people happy and we've made a lot of people mad, and a lot of people happy and a lot of people mad, and that's kind of just part of being a city council member. So have a good holiday weekend. Is there a motion to adjourn? Councilor Shack?
I move we adjourn.
The second, Councilor Calvert. Motion by Councilor Shack and a second by Councilor Calvert to adjourn. All in favor say aye. Aye.
Aye.
We are adjourned.
Mayor?
Yes.
I didn't hear the effective date.
Oh, excuse me. You're